I'm reviewing the MAR and I see that my patient needs an IV. So now I'm gathering my supplies here and I'm entering the room. Hi, my name's Connor. I'm going to be your nurse today. Can I get your name and date of birth? Okay. Do you have any allergies? Perfect. I'm just going to wash my hands and provide us some privacy. So I saw on the MAR that you need an IV, so I brought all the supplies to give you an IV. So this is just gonna, I'll just give you a little education on it. This is just gonna help you have an access port to give medication straight into your vein, and this will help it metabolize or work faster, okay? So I'm just gonna set up my supplies here. I'm gonna connect this tubing, making sure I keep this sterile. Okay. I'm just priming the tube. All right, there's a little leak. Now I have this ready. I'm also going to get this Tegaderm ready. Okay. So next, I'm just gonna put this under your arm quick. All right, and then I want to do this 4 to 6 inches above where I want to give the IV, using a quick release knot. All right, then I'm feeling the vein, and this feels like a good vein. This is where I want to do it. So I'm just going to take this off because I don't want it on there for longer than 2 minutes. I'm going to wash my hands and grab gloves. All right, so next I want to clean the site. I'm going to clean the site back and forth for 30 seconds. And then I'm going to let that air dry. While I'm doing that, I'm going to put the tourniquet back on. Using a quick release knot again. And then I'm gonna get my catheter ready. All right, so I'm gonna use the bevel up. I located the vein right here. I'm gonna use my thumb. Then I'm going to just insert it and pull the catheter tip off here then. And I see that I have flashback here. Do you see that? Mm-hmm. Okay, so now I'm going to advance the catheter forward while pulling out the needle. Then I'm going to remove this. This is going to drip a little bit, so I'm trying to use my middle finger to hold it, but it's going to drip. So then I'm going to connect this on, okay? And then I'm stabilizing this the entire time, and I'm going to get rid of this into my sharps container. And once I have this, I want to make sure I take the tourniquet off. So I'm stabilizing this. I'm going to flush this. And with the pressure on the vein, it doesn't really let me flush, so I would flush that. It just pushes it back out. So now I'm holding onto this, and I want to check. Just make sure that the normal saline is making it into the vein, which it is. So then I'm going to take my Tegaderm and secure the IV site. And I want to make sure that I put this on over the hub so that helps stabilize the hub. I'm taking this off. And I'm making sure to save this so I can write on it. So now I see that this is stable. I'm going to disconnect this. I'm going to tape this on to the skin. grabbed a little too much tape, so I'll rip some of that off. And I'm making sure that the tape is not on the IV site. Okay? And then I also want to put my initials, the time, and the date on here. So I'm just going to put this sticker on, and I'll write on it before I put the sticker on here, so we know when this was inserted. All right, then I'm going to clean up all my supplies, and I would get rid of this in the sharps container. And then I would make sure that I leave the patient in a comfortable position. And obviously before inserting the IV site, if they were in a bed, I would have raised the bed, and now I can lower it and make sure that they're in a comfortable position, give them their call light, take all this away, and then that's what I would do. And I would take my gloves off and wash my hands. So I'm just gonna do that quick. Then I'm washing my hands. And then this stuff would all be put away. But now, when I'm going to come take it off, then I would come in and I would do my K-wipes and I would sit down. So I'm gonna wash my hands, and then I'm gonna put on gloves as well as lock this so it doesn't spill. And I'm also grabbing my supplies, so I need gauze and tape. Okay, so I have my supplies, I've washed my hands, and now I'm putting on gloves. All right, then I'm going to stabilize this while I'm taking off the tape. So I'm stabilizing this while I'm pulling off this tegaderm, and I want to be pushing against the skin so I'm not ripping on any of the hair. So I'm just taking the edges right now and pushing against the skin. When I get close to taking this off, I want to stabilize this when I pull off the tape. All right, so now we have this, and I'm stabilizing it. I'm taking a piece of gauze, and I'm holding it right on the IV site. And then I'm going to pull straight back, and then apply pressure. So I'm applying pressure for 2 to 3 minutes, and the first thing I want to check, make sure the catheter is not broken and the tip is connected. So we see that, and we see that that is good. Now, while I'm holding this for 2 to 3 minutes, I want to educate the patient to let me know if this ever starts bleeding or is there any other abnormalities, to let me know by pushing their call light. So now, once it's been 2 to 3 minutes, I can take this off, and then I would take a new piece of gauze, and I would wrap it up and put it on here, and I'm going to tape it. All right. And then I'm gonna wanna clean up all my supplies and throw away anything that I need, that I don't need. Then I'm going to wash my hands and make sure I leave the patient in a comfortable position, lower the bed, give them their call light, ask them if they need anything else. And then I'm going to go document relevant information into the EHR, such as the site and other things that are important. And then that's it. So then now we do our peer review. Just flip.
Yes.
Oh yeah, you probably can't. Okay, perfect.
Okay, I think that's fine.
Yeah. We have our peer review sheet here.
Actually, hopefully they can see us.
Yeah. Okay.
All right, so Connor, you were very polite and professional. You did a great job at really thoroughly explaining every step. I believe that when you do this in real life, you will have the ability to do it step by step. You did a good job at educating the patient in the beginning, as well as like giving a step by step for like instructions is exactly what you were doing, especially for a patient who wants to know like what every step of the process, I guess,
Right.
Like what you're doing. I guess like in real life when you would do this, maybe like preparing, like letting the patient know like when you're gonna poke them, like all right, I'm gonna be poking you, especially if depending on the situation, like if they're nervous or they want to know when they're being poked. You knew the content really well. You knew what you were doing. You documented. You ensured that the environment was sterile, and the patient was safe. You're very clear. You demonstrated your care very well. I'm trying to think. Overall, you did a really good job. Other than I guess little things of letting the patient know exactly what you're doing, but other than that, you did really well.
Yeah, I can definitely implement that next time. I think I definitely did miss that. I think that you've been a very good help while we've been practicing. I think just like reminding me to remember these little things, raise the bed, lower the bed, just things like that. And I think that has been helpful for me when I'm like learning to have someone that's, I don't know, just gonna help me in any aspect. 'Cause those little things that you're gonna miss. But other than that, yeah, very respectful. Obviously, we're dressed correctly. Yeah, I think just having a good partner to help me, like, teach me how to do the documentation on the EHR and stuff like that. So that's been really helpful. Yeah, just having someone that's supportive and helping me learn, help me remember things that I forget. So, based on this experience, how will you approach your next peer review situation? I think I'm just gonna think how did you help me, or what things did you do to help me in the future, and just like I said, reminding me those little things that's really helpful for me. So for my next partner, if that's you or whoever, I want to try to do that and be the best partner that I can be. So
Awesome.
yeah.